Hello everyone, welcome back to my channel. In this video, we will be seeing about the questions which can be useful for your nursing competitive exams. It can be for ESI, NORCET, or even this can be useful for your NCLEX. So here I am going to explain with the rationale. So if you like my video, please give one like and subscribe my video. So let us see the first question. The nurse notes blanching, coolness, and edema at the peripheral intravenous site. On the basis of these findings, the nurse should implement which action? Option A. Remove the IV. Option B. Apply a warm compress. Option C. Check for a blood return. Option D. Measure the area of infiltration. So here you need to concentrate on blanching, coolness and edema. So the answer is remove the IV because blanching, coolness and edema are the signs of infiltration, and infiltration can be damaging the surrounding tissues. So appropriate action could be to remove the IV, mainly to prevent any further damage. Let us see the next question. The nurse is choosing age appropriate toys for a toddler. Which toy is the best choice for this age? So here we need to concentrate on toddler age group. Option A, puzzle. Option B, toy shoulders. Option C, large stocking blocks. Option D, a card game with large pictures. So here the answer is large stocking blocks, because a puzzle and toy soldiers will be harmful for a toddler because there is a chance of keeping them in the mouth, and even a card game with large pictures may require cooperative play, and this can be appropriate for school age child. So here we need to use large stocking blocks. Coming to next one, the nurse prepares to care for a client on contact precautions who has a hospital acquired infection caused by methicillin resistant Staphylococcus aureus. The client has abdominal wound that requires irrigation and has a tracheostomy attached to mechanical ventilator which requires frequent suctioning. The nurse should assemble which necessary protective items before entering the client's room. So here proper PPE the nurse should use before entering the client's room. So option A, gloves and gown. Option B, gloves and face shield. Option C, gloves, gown and face shield. And option D, gloves, gown and shoe protectors. So here the appropriate protective items can be gloves, gown and face shield, because there is a chance of splashes of infective material when caring during the wound irrigation or suctioning of tracheostomy. A client with Parkinson's disease develops akinesia while ambulating, increasing the risk for falls. Which suggestion should the nurse provide to the client to alleviate this problem? Option A, use a wheelchair to move around. Option B, stand erect and use a cane to ambulate. Option C, keep the feet close together while ambulating and use a walker. And option D, consciously think about walking over imaginary lines on the floor. So in question directly it is given that Parkinson's disease and there is a chance of developing akinesia. So the correct answer is consciously think about walking over imaginary lines on the floor, because clients with Parkinson's disease can develop bradykinesia, that is slow movement, or akinesia, that is freezing or no movement. So having these symptoms, here the clients can walk on the imaginary lines on the floor which can keep them moving forward while remaining safe. Coming to next question. A client with renal insufficiency has a magnesium level of 3.5 milliequivalent per liter. On the basis of this laboratory result, the nurse interprets which sign as significant. So here we need to concentrate on the magnesium level and we need to know the answer. Option A, hyperpnea. Option B, drowsiness. Option C, hypertension. Option D, physical hyperactivity. And the answer is drowsiness. Here, the normal magnesium level is 1.5 to 2.5 milliequivalent per liter. And in question already we have got that it is 3.5 milliequivalent per liter, which indicates hypermagnesemia. So whenever the patient is having hypermagnesemia, then there is a chance of neurological manifestations like depression, drowsiness, sedation, lethargy, respiratory depression, muscle weakness and areflexia. So the answer is drowsiness. Coming to next question. The nurse is caring for a client with a diagnosis of heart failure who suddenly complains of shortness of breath and dyspnea. The nurse should take which immediate action? So in question it is very clear that shortness of breath and dyspnea. So whenever we are having shortness of breath and dyspnea, we need to concentrate on option A, administer oxygen to the client. Option B, prepare to administer furosemide. Option C, elevate the head of the client's bed. And option D, call the healthcare provider. So here shortness of breath and dyspnea, then we need to change the position of the patient, that is elevate the head of the client's bed. Next one, a client with a diagnosis of cancer is receiving morphine sulfate for pain. The nurse should employ which priority action in the care of the client? Option A, monitor stools. Option B, encourage fluid intake. Option C, monitor urine output. And option D, encourage the client to cough and deep breathe. So here morphine sulfate is given for pain, but we need to know whether is there any side effects or any adverse reactions which happens due to morphine sulfate. So here the correct answer is encourage the client to cough and deep breathe, because morphine sulfate suppresses the cough reflex and the respiratory reflex, and the respiratory depression is the common adverse effect of morphine sulfate. Next one, the nurse developing a plan of care for a client with cataract understands that which problem is the priority. The nurse developing a plan of care for a client with a cataract. So here the options are concern about the loss of eyesight, altered vision due to opacity of the ocular lens, difficulty moving around because of the need for glasses, and option D, becoming lonely because of decreased community immersion. So here it is a direct question. So nurse is going to plan care for a client who is having cataract. So we need to know the definition of cataract, that is altered vision due to opacity of the ocular lens. So clouding of appearance will be there, and which can lead to altered vision in the clients. Next one, the nurse is caring for a hospitalized client with angina pectoris who begins to experience chest pain. The nurse administers a nitroglycerin tablet sublingually as prescribed, but the pain is unrelieved. The nurse should take which action next? So here already they have given that the client is having chest pain. Already the nurse has given nitroglycerin tablet, that also sublingually, but the pain is unrelieved. What action should be taken next? So we need to concentrate on that. Reposition the client, call the client's family members, contact the healthcare provider, and administer another nitroglycerin tablet. So here the answer is administer another nitroglycerin tablet, because the nurse can administer 3 nitroglycerin tablets 5 minutes apart from each other. That is, for first 15 minutes, for each 5 minutes, one tablet can be given, that is 3, in order to relieve chest pain in a hospitalized client. If the pain is not relieved even after giving 3 nitroglycerin tablets, then the nurse should inform the physician and other treatment measures should be taken. More than 3 tablets should not be given. And the last one is, pulmonary artery is originated from left ventricle. Whether it is true or false, please answer it in comment box and check your knowledge. And if you like this video, give one like and subscribe my channel for the upcoming videos.